And so one of the major things that I want to begin with is something called central regulation. And central regulation basically is talking about how the brain, or the hypothalamus and the pituitary, talk to the thyroid gland. And this is really important for you to understand. So beginning with the hypothalamus actually is a structure within the brain, and it kind of senses the environment. It senses the external environment, and it also senses the internal environment. And so what happens is that, let's say you have low thyroid. So the thyroid gland isn't producing enough thyroid hormone. And as a result of that, the hypothalamus is going to get wind of that. And it's going to say, oh, okay, something's going on here, and I'm not getting enough thyroid hormone. So I'm going to put out a message. And these are chemical messengers or hormonal messages. And so it puts out a message to the pituitary gland. And as a result, it's almost like a relay. As a result, the pituitary says, oh, I've got to put out my hormone as well. And so it puts out thyroid stimulating hormone, or TSH. And what it does, and the reason it does that is because if you have low levels of thyroid hormone, then the pituitary is going to signal and say, okay, you need to increase production of thyroid hormone, thyroid gland. And so what happens as a result, you get an increase in that hormone, or thyroid stimulating hormone. So if somebody's diagnosed with hypothyroidism, what happens? You have low thyroid hormones, right? But your TSH is generally elevated. Okay, now you have the other scenario. What if you have too much thyroid hormone that's circulating in the bloodstream? Then what happens is that information gets fed back up to the hypothalamus, back to the pituitary gland, and it says, okay, body, you need, or thyroid, you need to slow down the production of thyroid hormone. So what tends to happen is that the TSH goes down. And so this is hyperthyroidism. Hyper meaning a lot of thyroid hormone is circulating in the blood, but then you have a low thyroid stimulating hormone, or TSH. So those are basically, you know, the yin and the yang of thyroid hormone. Now, there's a lot of little nuances, and it doesn't always present itself that clearly. But the body tries to regulate itself. It tries to regulate itself well. And I think what happens over time is that something occurs which causes dysregulation in the body. And when I say something, what is that big something? Generally, it has something to do with our diet. It probably has something to do with the stress levels that we all have. What about our environment? How does the environment impact the thyroid hormone, or the thyroid function? So when I talk about thyroid hormone disorders, I really want you to understand that it's multifactorial. There's not just necessarily one reason why the thyroid becomes dysregulated. Okay? So as a naturopathic physician, it's my job to sort of figure out what is the barriers to healing. What is preventing the body from doing what it's supposed to do naturally? Because the body is not supposed to get out of whack. What is creating that imbalance? So we're going to go through some of those things today so that you can help identify for yourself what in your world might be impacting the way your thyroid is functioning.